Good afternoon, everybody. The Secretary to the Government of the Federation and Chairman of PTF, Honorable Ministers, Permanent Secretaries, Directors and Directors General, ladies and gentlemen of the press. By way of update, 193 new COVID-19 cases were confirmed in the past day in 15 states: Lagos 58, Kano 46, Jigawa 35, Yobe 12, FCT 9, Ogun 7, Plateau 5, Gombe 5, Imo 4, Edo 3, Kwara 3, Borno 3, Bauchi 1, Nasarawa, Ondo 1, bringing the total number of confirmed cases in Nigeria over the 5,000 line to 5,162 in 34 states and the FCT. Till date, 1,180 patients have been treated and discharged from hospital care, and 167 deaths have been sadly recorded. The case gender ratio remains about 70 to 30% for men and women respectively, while case fatality hovers around 3%. A steady rise in these figures is what we envisaged, with more diligent testing, treatment, isolation, and tracing. Ability and capacity to keep up and align these activities with each other will determine the course of events as time goes on. We implore states and partners not to relent, but to keep up with the pace, which in some states will increase well before it begins to decrease. Adherence to advisory against interstate travel and compliance with other simple measures like the use of masks and avoiding crowds will significantly mitigate the burden. The situation in Kano has largely stabilized, as you heard from the chairman, thanks to the good relationship between the visiting federal task team and the Kano State Task Force on COVID-19. One manifestation of this being the high number of new cases recorded daily from the fact that all labs in Kano are now functioning and clearing the sample backlog with over 350 tests that can be done daily. The state government has been doing well in opening up more treatment and isolation centers. A strategy document of the National Primary Healthcare Development Agency is being developed and repurposed for application to Kano, but also to similar high-density, high-burden metropoles like Lagos to respond more specifically to the challenges of COVID-19 tracing, tracking, testing, isolation, and treatment in congested communities. If implemented, it could go a long way in addressing many challenges looming before us. An innovation of the Federal Ministry of Health in Kano, of the Kano task team, is the training of journalists to take place tomorrow, the aim of which is to ensure that reporters are in a better position to interpret COVID-19 related data and information, and also learn to take necessary infection prevention measures. I shall use this opportunity to thank His Excellency the Governor of Kano State for providing the necessary support for the federal team to function. The Federal Ministry of Health team has been assembled to proceed to Sokoto and Borno on fact-finding and support missions to engage with state authorities and determine material and technical needs. A most immediate probability is the prioritization of these states for the deployment of the repurposed gene expert machines as soon as we start receiving the cartridges in a few weeks to bring speed to testing. As mentioned earlier, part of the mission in Kano is to assist state pathologists and scientists to unravel the mysteries around unexplained deaths in some states. The tools for the forensic investigation have been jointly developed for a uniform approach and balanced results. We have been able to persuade the popularly known Benue lady to allow a test sample to be taken to our laboratory for testing. The result is being awaited any time now and will be given to her in person. Please note that while the patient may disclose their result by themselves, the Federal Ministry of Health cannot and will not do so except it has the permission of the person concerned. The annual World Health Assembly, which is held every year in Geneva, shall begin on Monday the 18th of May and hold this year for the first time by teleconference. I shall be leading the Nigerian team to the virtual meeting, the focus of which is expected to be the global spread and response to COVID-19, requiring individual, collective, and national effort. Finally, I shall reiterate again the importance of adhering to public health advisories, wearing our masks, observing social distancing, practicing hand washing or sanitizing, standard respiratory hygiene, avoiding crowds, and above all non-essential travel. The importance of these and similar measures is such that compliance should be taken as a civic duty and obligation for every citizen, where each should be responsible for the other. As such, enforcement or policing should not be necessary for what is meant to preserve life and health. Therefore, I call for considerate attitude and social adjustment to the challenges we face at this time. Thank you for listening.